In this video, I demonstrate how to do a basic posterior to anterior thoracic chiropractic adjustment. These thoracic posterior to anterior adjustments are done to one or several segments in the thoracic spine that are restricted or fixated or turned to one side as determined by motion palpation. Chiropractic adjustments are high velocity, low amplitude, and using short lever. So this isn't all about hammering down as hard as you can or pushing into the patient. This is a very short thrust. My hands, as I do the adjustment, travel less than half an inch. Take a deep breath. Now here's an alternative way to adjust the thoracic spine with a patient lying on her back. Your adjusting hand is positioned like this, and the thoracic spinous processes will fit into this groove. You place it underneath the patient's back, tell her to breathe in, have her cross her arms, and it's a very short, quick thrust, and you're aiming your sternum at an angle straight into your hand that's underneath her back. Little squeeze, that's all it is.